Hi, everybody. Judy Seeger, your host of the Ozone Therapy Summit, back online with another expert here for you guys. We have been having some wonderful experts sharing their experience using ozone therapy in their practice, from medical doctors, veterinarians to biological dentists, and then some. And so today we have another special guest who's going to be talking about using ozone therapy in their practice as a dentist, as a biological dentist. So Dr. Chris Edwards, thank you so much for being on here today.
My pleasure to share what I know.
Yeah, and you're right here in my backyard in Florida. So we have lots to be grateful for, to be here in sunny Florida. And I'm just so happy to have met you and want to get into a whole bunch of cool stuff with how ozone therapy is used in your practice. Well, first of all, just so everybody gets to know you, as a conventional dentist, how long have you been practicing, doctor?
Well, I graduated from dental school in 1978. That was in Philadelphia, and practiced 5 years in Hawaii and 20 years in Rhode Island, and I've been 15 years now in Florida.
Wow. So altogether, almost...
February 2nd or 3rd, which is today, marks the actual 15th anniversary of my practice, Smile Design Center in Florida.
Wow. So in total, almost 40 years as a dentist.
That's correct.
Wow. So using ozone therapy in your practice, how long have you been using that?
I think 6 or 7 years is about when I was when I got my first ozone machine and was trained in ozone.
Dr. Edwards, what was it that attracted you to the whole ozone therapy? Because so many of us started out traditionally and decided that ozone therapy was something to put in our practice. So what made you decide that you wanted to use ozone therapy?
Well, as a natural, holistic kind of dentist, when I learned about ozone and its power and being a natural agent, it just made sense that we could start controlling and killing a bacteria and doing it in a way that actually the body does. It's actually interesting that our own antibodies use ozone when they're killing a pathogen inside of us. So it's our own mechanism of killing a pathogen that's in the body. And interestingly enough, the mouth is outside the body. It's an interesting thing. It's obviously the start of the digestive system, but if you think of the tooth and bacteria living and growing on the tooth, which happens all the time. We have bacteria, everybody's got bacteria in their mouth, and they want to create a biofilm, and the biofilm lives on the tooth. Our immune system really cannot grab that pathogen. And although our immune system is aware of it, so like, for example, a bacteria that's under the gum and attached to the side of the tooth and is building colonies and more pathogenic bacteria coming in there, our gum is almost right up against there, but it can't grab that bacteria because it's not within the body. And therefore, we created an inflammatory response in the gum of trying to kill a bacteria that it can't kill. And that's, in dentistry, we're basically looking at the microbiome, which, we used to always think, any bacteria is bad. We've really come to learn that the microbiome is crucial to health, but it's really a question of cultivating a healthy microbiome.
Okay, let's stop right there. So that the viewers understand, because we throw these words around and not everybody always understands what it means. What is microbiome?
Well, the microbiome is a term to encompass a collection of all of those microbes that live in us, on us, around us, in every orifice. And they're saying that there are 10 times as many microbes as there are human cells. And there's 70 trillion cells. So there's 700 trillion microbes that are on our skin and in our eyes and in our ears and certainly in our mouth. There's hundreds of different types of bacteria in the mouth. And we've actually come to learn, because I'm actually very fascinated with the microbiome, because that's really what I do. And I've studied it. I went to the Microbiome Summit, as a matter of fact, and I own it. I bought it. I've listened to it, and it's fascinating. And in our naturopathic training, we were taught about the second brain, which is the gut, and the gut is really where our immune system resides. And it's really all about the microbiome in the gut that is influencing health and the immune system. And what is the beginning of the gut but the mouth? So, and what is decay? Decay is an imbalance of the microbiome that leads to, the dissolving of the tooth and the bacteria eating away the tooth. What is gum disease? It's an imbalance of the microbiome. Now, this not includes bacteria, but it also includes viruses, funguses, protozoans, amoebas, all these little critters that are living in harmony. And it's fascinating, how they work. One of the interesting things is that our microbiome is actually probably our most potent immune system. So when a pathogen comes into the microbiome that's healthy, that microbiome eliminates that pathogen before it actually ever gets into our body. We don't even realize that the microbiome is so crucial to health. And that goes certainly in the mouth. So my goal is to really help my patients become healthy by creating a healthy microbiome in their mouth. And a lot of that relates to biofilm, which is what bacteria do. They start growing and creating this sticky, gooey stuff. On teeth, we call it plaque. But there's all kinds of biofilms, and as you go down the rabbit hole, that sounds weird, but down the rabbit hole of healing, like with Lyme disease, it's the biofilm that's really what you got to try and kill. It's not the actual spirochete, but it's the cysts and the spore forms and all those other things that the biofilm are used to protect itself so that the immune system can't get to it.
So Dr. Edwardson, does the ozone go in there? Because that's fascinating. I mean, I love the whole microbiome too as a naturopath. But the bad bacteria is, of course, what everybody's always worried about in their mouth. So does the ozone go in there and can basically eliminate all the bad bacteria that doesn't belong in there? How does that work?
Well, it's all the bacteria, basically, but basically if you clean the slate, and now you feed the environment with the good bacteria, and we're now using oral probiotics. So we're actually having our patients actually chew the bacteria that are beneficial and repopulating the mouth with healthy bacteria. As a matter of fact, one of the ways that
we're used to taking the viewers will always talk about, what kind of probiotics do they need, how many parts per million, billion, what type and all that. But I've not heard that. I just learned something new from you, is that to put it chewable in your mouth. How does that work?
Sure. Well, it's an oral probiotic. And basically, you're taking a tablet that is laden with bacteria, and you are chewing it and populating the mouth with it. So one of the ways that we use this, because this gets back to ozone, is that for a patient that comes in that has pretty severe decay, a lot of decay, their mouth is really out of balance, and gum disease, we'll recommend ozone tray therapy. And what that means is that we will create a little gas chamber, a little rubber tray that fits on top of the teeth and seals on the gum all the way around. And we have one ozone tube that goes in and one that goes out. And we basically pump ozone gas at a pretty high concentration into this chamber that is surrounding the gums and the teeth. And that is getting under the gum and between the teeth. And we're actually, killing bacteria, all bacteria, good and bad. And if we go ahead and add to that a good hygiene program where we're going ahead and using ultrasonic instrumentation with ozone water, with water that has ozone molecules in it, we're cleaning the biofilm off the teeth. We now go ahead and get the patient to do much better in their own hygiene and removing the bacteria, the biofilm that starts developing instantly. And then we go ahead and add xylitol is one of my favorite things. I am Dr. Xylitol is one of my handles. So we add xylitol into the equation, which brings the pH up in the mouth and goes ahead and adds the minerals to start rebuilding the tooth. And then we go ahead and have the patient chew an oral probiotic. We actually are now seeding the mouth with the bacteria that are beneficial to health. So it's a whole complex of controlling the microbiome and the environment in the mouth. And of course, what the patient puts into their mouth is also crucial. Diet, I don't have to get into that, but refined sugar is a scourge of modern health. And, most of us are eating it even though we don't even think we are.
Yeah, and fresh fruit, and there's sugar in everywhere, that's for sure. But most of the viewers on here are savvy, that they know that the sugar is bad on many levels. So they know that. They just want to know what they could do to bring their balance back into the health of their teeth. And so let's talk about some of those things that I know that they're always asking about. So for example, the big one, of course, is those who have cancer are starting to realize that there's a connection with root canals and their cancer. Not always, but a lot of times there's a connection. And so they're worried about their root canals and want to clean that out or want to do something to bring that back into balance. What do you recommend to help them understand how ozone therapy could possibly help them with the root canal issue?
Well, that's a big subject to talk about, root canals, and it's controversial. I think that each root canal has to be evaluated on its own. Some people feel like every root canal should be removed out of the body. And to be honest with you, I have one in my own mouth and I'm not taking that tooth out. And yet I do agree that a root canal that has a chronic infection around it has the potential to have systemic effects and be affecting the whole immune system. And I do believe in the meridian system. That each tooth has its own meridian. And
yeah, stop right there, just because I know some people don't understand that. What do you mean that each tooth has a meridian?
Well, if you look at the Chinese way of health, just like on the hand, every point on the hand is attached to, and the foot and the ear are all attached to the meridians. Well, the teeth are also. And that tooth might be related to the meridian that goes to the shoulder and to the pancreas, or the lung and, the knee. And, so there's a relationship that if a tooth is infected or is out of balance with a chronic inflammation, which, can be a root canal that was not successful, that can affect you. And, yeah, I think if I had cancer, I would want to have all of my teeth looked at really closely. And I'm one that still believes that a root canal has its place in dentistry. But I think that for a tooth that's chronically infected, that has a long-standing infection, I'll recommend that is removed by my patient. So, it's I'm not in the middle of the road. I lean towards the left, if you might say. But, so, and to get to root canals, the feeling on that is that the root canal is done to clean out the main trunk of the tree, which is the main tube that goes down the root. And off of that are side branches and then smaller branches called tubules. And these tubules have living, when the tooth's alive, have a living process in an odontoblast. And when a tooth dies, those tubules, the odontoblast dies, and bacteria can actually camp out in these tubules. So when we do a root canal on an infected tooth, we might clean the main trunk, but those tubules can be left with bacteria or toxins in them that can create, a low-grade chronic response. So in the root canals that we do here in our practice, and we don't do the molar root canals because they're more difficult, we'll gas the tooth with ozone. So that's one of the ways that many ways we use ozone in the practice, is that we will actually, after we've cleaned out the inside of the tooth all the way down to the very tip of the root, we'll actually flood that area with ozone gas. We'll also use ozone water when we're irrigating the cleaning of the tooth out, but we actually will gas the tooth, or ozone gas the tooth. And sometimes we'll actually give an injection of ozone, into the gum around where the end of the root would be, and that perfuses through the bone and into that area. So I don't know, I might have got off tangent there, but do you think I answered that question? Or
you did. That was perfect. That's we just want to know how you're using the ozone on the root canal, and you explained it perfectly. And so the other issue, of course, that people are struggling with is the amalgams, right? They know that when they're on a cancer healing journey or they have autoimmune issues, that they're really struggling with knowing that this poison is in their teeth, the amalgams that are filled with mercury. And so they want it extracted. And I know when I had my clinic, I had people get theirs extracted many times. Not always, but many times. And so in your experience in getting rid of those amalgams and then making sure that they're really getting that taken care of and the mercury, how do you see the connection with using ozone for that kind of situation?
I don't think there's much connection between removal of mercury amalgams and ozone, in my personal opinion. And as a dentist, I'm really not allowed to diagnose mercury toxicity, on a patient. It's really a medical doctor that can do it. And as you know, in Florida, naturopaths are not recognized as a specialty. So I'm practicing as a dentist with naturopathic training, but I'm not a naturopath. So, and I think that mercury toxicity is a whole big issue, that should be explored. And certainly if I had cancer, I would probably consider doing it, removing my mercury amalgams. But I think I would get tested first. I would really have somebody that understands toxicity and mercury toxicity, because the mercury in the mouth is just the tip of the iceberg. What's really important is the mercury that's in the cells and in the matrix, the interstitial tissue, and as well as what is our own body's ability to chelate or remove mercury. We have that ability, and what are the other sources of mercury that we've been exposed to? So, it's
no, you're absolutely right. And it takes a lot to get rid of it because it's systemic. It's not just in your teeth, but of course it goes systemic. And so it has to be taken care of from the whole body. So as far as gum disease and that, you had mentioned that you use some kind of dam to get the ozone into the gums. How soon after people come in, and we're looking now, of course, for your case studies of people who've seen improvement, when they have gum disease and they get the ozone done, how soon do they get relief? How long does it take for them?
Well, ozone is interesting. One of the benefits of ozone is that it takes away pain. One of the many things, it reduces inflammation, it takes away pain, it stimulates your body's healing, your immune system, it upregulates a lot of different systems. So, it's interesting. It's not a magic bullet. My associate, my partner and I were having a discussion this last week because we had a patient that we sent to the oral surgeon. It was his patient. It was an elderly patient and had their remaining teeth extracted. And they came back all black and blue and in pain. And he and I were saying, why are we not experiencing that? Because we do a fair amount of extractions and we do it in our own biologic technique. One of the things that we use is ozone. We actually use ozone down into the bottom of the socket after we've really cleaned out the infection with a laser and made sure we've removed as much of the pathogens as we can. We actually will ozone, gas right into the socket. We'll also rinse with ozone water. And then we use actually PRF, which is, a product taken from the patient's own blood, and that goes back into the socket. And our patients seem to have no pain. Maybe no pain is, let's say no pain, but mild soreness. We never use our narcotics. And, and they seem to they're so surprised at how well they do. Very rarely will we ever get any kind of a black and blue or swelling. So I think ozone is part of that recipe that we use that upregulates the body and minimizes, pain, so.
So that's huge. So the type of diseases that you work with in the mouth and how you use the different applications, let's talk a little bit about that because people don't even know how to apply it. And then you talked earlier about using the water in your practice and ozonating water and that. So explain to us what that all involves and because people don't know the options even. So let's talk about what are some of their options.
If we can break just for a minute, I am in my office and the cleaning lady is approaching me with a vacuum. And I don't know if you're hearing it in the background, but there's like a high-pitched whine and it keeps getting louder. So I've got to move to a different place, which I can, or I need to get her to shut it off because I'm afraid that it's going to ruin your video.
Well, we're live and we're recording right
All
now.
right. So,
No editing is
live,
allowed.
live from
We're
Vieira,
live.
Florida.
That's
It's
all right.
Chris Edwards.
Yeah.
And
So we'll just have
Saturday
to keep
morning.
going.
And
Sorry?
it's Saturday morning.
Yeah, and it's Saturday morning. People don't know the dedication that we have in this. So it's okay. I'm not hearing it that much, so it's fine.
Okay.
Yeah,
All right.
so yeah, let's talk about the therapies and how it's used for gum disease and that, doc.
Okay. So again, it's ozone is just is one of the arrows in our quiver. And, so treating of gum disease, ozone is, I discussed using ozone tray therapy, and that's for a more severe case. But otherwise, the treatment of gum disease is removing the biofilm from the teeth, which is, an excellent dental hygienist who can clean not only above the gum, but below the gum. And that involves using ultrasonic instrumentation is what we found is the best. And if we use ozonated water in that ultrasonic, we're now getting ozone down under the gum into the pockets or the areas where gum disease is. On a maintenance basis, when a patient that we're maintaining a periodontal problem that has continued periodontal problems, and trust me, most adults have it at some level, okay? We will actually take a syringe of ozone, and this is a syringe without a pointed needle, but with a round needle at the end. And we will actually put it under the gum into the pocket, and we will go ahead and bubble the ozone under the gum and treat the pockets that way. And, and for more serious gum disease problems, I will actually do a treatment myself where I'll use my laser, actually 2 different lasers, under the gum and treat the pocket with laser treatment, and ozone is part of that.
Right. So how soon after? I can't imagine needles in my gum. That.
Yeah, well, it's not a short needle. It's not a short needle.
Oh, it's not.
No, it's a cannula. It's just a little. It looks like a needle, but you can't inject it into the skin.
So it's not painful.
No, not at all.
I need to know. Most of us don't like dentists. We love you, but we don't really love the whole pain process. So when you say there's no pain, that's awesome. Then we're all good to go. How soon do you see people? Because typically when I sent my people off to the biological dentist, they would say their mouth feels really clean. And I'm like, well, you feel that after you brush your teeth. And they said, no, it's a different kind of clean. It just feels fresh. And yeah, but how soon typically if they're having issues with periodontal disease, and I know it's case by case, I understand, maybe you could bring up some specific cases. How long does it take for them to see noticeable improvement in their mouth?
Well, I think that the improvement can happen within days. Okay.
Wow.
And yeah, and it's amazing that once you start controlling the microbiome again, and the heavy bacteria and toxins and accretions are taken off the roots of the teeth, and the patient is taught how to do a better job maintaining it on a daily basis, the body responds. It's pretty amazing how fast it can start healing, and typically, so for a patient that comes in with a periodontal gum disease problem, let's say, that has pockets, 5 or 6 millimeters deep under the gum, which are areas that the patient can get to, even if they want to and try their best, they can't get to those areas. After an initial cleaning where we start getting the heavy stuff off and get down to those pockets, we'll see results right away. And then the patient is brought back for individual, what we call root planing and scaling, which are deeper areas that are going, to really work on each root individually to really try and clean all of the tartar, the calculus, the bacteria, the toxins off of it. And that's where, again, we use ozone in those visits. At the end of the visit, we'll be using ozone gas, as well as I said, we use ozonated water in our ultrasonics.
Yeah, and that's right there. That's huge as well. And you also, I understand, you use ozonated olive oil. First of all, let's explain, because I know some people don't understand what that is, and then how you apply it for your patients.
Okay. Well, ozone is an unstable molecule, okay? It's a O2 that has been broken apart, and now a third oxygen joins on, so now you have O3. And that extra oxygen is unstable. It's got an electron charge, which is how it works so powerfully. That's how that charge grabs the cell wall of a bacteria and explodes, rips it apart. And, and that's how it kills bacteria, viruses, all these things that, that antibiotics don't kill. And so the ozone is unstable even in water. If you put it in water an hour later, half of it is gone. And when you draw a syringe of ozone up out of the ozone machine, in a matter of minutes, that ozone, O3, is going back to O2. It's actually a mixture of O2 plus some O3. So you've got to make it and use it, which is what we do in our practice. We have an ozone machine right there that we, when we're ready, let's say, for example, I've got a cavity. Every time that I drill a tooth open, and if there's decay, we'll go ahead before we fill the tooth. We have a little like gas chamber, a little silicone cup that we stick on top of the tooth, and we just flood the tooth for about a minute with a high concentration of ozone gas. And what that's doing is it's making sure that all the bacteria are killed and that the pulp is actually infused with ozone, that those tubules that we talked about earlier go right into the dental pulp. So we actually can get ozone, can go into the pulp and can help the pulp to heal. And probably for me as a dentist, one of the things that I am most excited about ozone about is that I'm able to save the health of a pulp that previously was believed could not be saved. Once when I went to dental school, we thought that if one bacteria got into a pulp, that pulp would die and would need a root canal or be extracted, that there was no way to really save it. And nowadays, we know that the pulp has got a lot more power to heal than we ever thought. And if we can actually get ozone into the pulp, we can, number one, kill bacteria that are in the pulp. And number two, we can upregulate the healing. We can get the stem cells that are in the pulp to differentiate and to become new odontoblasts and heal, create a new layer of tooth. So I've had some experiences now where I've challenged myself to see if I can save a tooth that other dentists would say, absolutely you cannot save that tooth. And I've saved them.
And that's powerful because people don't like to lose their teeth. I know you get to that age and it's just like, I don't want to lose a tooth, so I'm not going to go to the dentist.
And I don't want a root canal.
Right. So that's brilliant that's actually a challenge that you set for yourself, and it of course helps the people. But with the ozonated olive oil, I've heard some people can use it for like oil pulling. Some people could put it on. How do you use it in your practice?
Yeah, I don't use ozonated olive oil that much in the mouth. It's pretty nasty tasting. And but I do believe in oil pulling. I like oil pulling. Okay. But not really with not with ozonated olive oils. Also, they're quite expensive. So a lot of times we use them topically, on a sore, on a lip sore, let's say, herpes of the lip, canker sores in the mouth. So that's where sometimes I'll use an ozonated olive oil, but not really putting them under the gum. Well, there are some of my colleagues are taking ozonated olive oil and putting it into a socket. When a tooth is extracted, they actually are injecting ozonated olive oil into a socket. They're coating an implant with it before they put an implant in. The jury's out for me on that as a best practice. So
there's different options, and people just need to understand what the options are. So are there any other ways that we need to know about as far as application with ozone therapy that you're using in your practice?
Well, I think that one of the things that's important for people to know is that dentists that are using ozonated water are providing a much cleaner water in their mouths. And we talked about biofilms earlier. Every water pipe in the country has got biofilms in it. The water coming out of your tap has got biofilms, right to where the water comes out, there's biofilms. And in our dental units, there are all these little rubber hoses that have water that are going to the drill and to the three-way syringe that, you know, we rinse your tooth with. And biofilms build up in these. And, you know, we as dentists are constantly fighting that biofilm. And the ozonated water cleans those tubes like you can't believe. So the water that we're using in a practice that's using ozonated water is much, much cleaner and doesn't have bacteria in it, you know, and I'm not trying to throw other dentists onto the bus that are not using that, but maybe they should be. And, you know, and maybe they should be getting their water tested.
Yeah, well, then we could talk a whole lot about the water.
And there's many other ways that us dentists clean, you know, water lines. So I don't want to, you know, say that we in dentistry are not aware of or dealing with this problem, but I think that this is the best way.
What about using ozonated water for even just rinsing their mouth out? Because I know a lot of people have home units. Ozonating water, drinking it, rinsing their mouth out regularly. How beneficial do you think that is?
I think it's probably very beneficial. You know, I think it's helpful. You know, and it's one of those things though that you got to realize you're killing the good and the bad bacteria, but you're also killing viruses and funguses and things like that. Right. I wouldn't say that it would replace flossing. How does that sound? Or good brushing. You know,
right. The combination effect. We always say that it's nutrition, it's good hygiene, it's good. You know, the whole picture has to be there for people. They can't just think that ozone is it. It's always a combination. And you even said you use ultrasound, you use the ozone in the water, you use the injection. There's many, many ways to do it.
Yes, we use the ozone every day. Pretty much every patient, you know, it gets one ozone method or another. You know, another thing is that I've seen a lot of teeth that are sick. You know, a patient will come in after a restoration, let's say, you know, and they had a crown done on a tooth that was already sick, let's say, and they'll come back and the tooth's a little bit sore, and in general that tooth would be on its way to, you know, the root canal graveyard. Or you know, sunshine treatment of the roots, as we would say, what an extraction is. And the injection of ozone can upregulate it and get the tooth to heal. And I've seen that happen so many times in my own practice that, you know, it's I believe it. It works.
Are there any examples that kind of stick out in your mind that, you know, they came in with something real serious like that, an abscess or pain or infection, that you could share with us?
Once an infection has taken place, you need to do definitive treatment. Okay, that ozone is not a magic bullet. You know, sometimes people will think that it can do, you know, magical things, and it can, but there's a limit. So if you have a tooth that's infected, usually the infection is because the pulp of the tooth has died, and in that pulp is necrosis. Bacteria are in there living and are, you know, your body has no way to get in there and deal with them. And as those bacteria leak out the end of the root of the tooth, the immune system is there and the body is managing it, fighting it, killing them, you know, and there's a chronic low-grade infection there. And eventually that infection can become acute, swelling, a lot of pain, pus, and all of that, you know, and that needs to be treated, you know, definitively, usually, you know, with an extraction and good debridement, not just an extraction, but actually cleaning the infection out and supporting the body and healing.
Yeah, exactly. And Doc, you know what people need to do is just take a trip down to Florida and hang out with you for a bit to get their issues cleared up. So what is your website, first of all, that they can find you?
My website is www.smiledesigncenter, all one word, .us.
Okay, smiledesigncenter.us. And we will have this in the website so that people could look you up as well. And it would be great for them to stop in and spend some time with you and get a whole program done, actually. I mean, Florida's a great place to visit anyway.
Well, you know what? I would be more than happy to help wherever I can. You know, actually, there's a waiting list to become a new patient because our new patient, we take only a limited number, and it's a 2-hour experience to really, you know, really learn about your mouth and how it relates to you and what your options might be. You know,
But I heard it's a fun clinic. That's the word out.
well, you know what, I'm very, very proud of my staff and, you know, and how we help people. And to be honest with you, patients have an experience here that they've never had, you know, of really feeling cared for and well served, and that we're really looking for their best health and their best interests.
Yeah, and so bottom line is they just need to learn what their options are, what the ozone could do for them. And if they could come here, great. If not, at least they could learn, and that's what this is all about, what their options are in using ozone therapy. So again, appreciate your time, Dr. Edwards, to share your knowledge, your experience, many, many years that you've been doing dentistry, and you could tell that you know your stuff, and obviously people are getting better. That's always the ultimate test. So appreciate your sharing and giving us your time to explain how ozone therapy works in your practice.
Well, it's been my pleasure. And to take the website, if you go to the resources section of my website, my wife and I have written over 70 articles on all various aspects of biological dentistry. Whether you want to learn about xylitol, about lasers, about PRF, about ozone, a lot of those are on that website. So feel free to peruse those. You can download them if you want yourself. And there's a lot of valuable information on that website, particularly in the resources section. So
thank you so much for that, because we didn't even get into PRFs and xylitol and all that. I mean, that's a whole other topic, but those are great resources that everybody who's watching here, go there. I mean, Dr. Edwards has put the work in, his wife has put the work in, completely free, learn, and then that way you are, you're empowered with the knowledge of what it takes to get your teeth to the level of health that your body needs. Because as you mentioned, Dr. Edwards, of course, is that your mouth, everything that's happening in there is a huge factor in your healing journey. So really appreciate that point. Thank you.
Yeah, I think that it's really important for people to know that if your mouth is not healthy, you are not healthy. There's absolutely, the mouth is, as we've come to learn, is so crucial to our overall health, you know, and our well-being and our smile and, you know, how we feel about ourselves. It's, you know, and I am blessed to be a dentist and, you know, helping people to get healthier. So it's been my pleasure to be on your show here and sharing.
Yeah, thank you so much, Doctor. And for the viewers who are on here, take what Dr. Edwards has said and start doing the research. Get on his website, read the resources, ask questions, because that's what this is all about, is learning it and then taking action. So thank you so much for watching. Thank you, Dr. Edwards, for being on here, and we will see you on the next interview. Take care.